Clinical Services Plan Stroke Services Phase 2 Consultation. A stroke is something that can happen to any of us at any time. A stroke is a serious, life-threatening medical condition that happens when the blood supply to part of the brain is cut off. Getting the right care can save a life, reduce brain damage, and improve recovery, helping people regain speech, movement, and independence. Not all strokes are the same. For each patient, the treatment pathway can differ. Following an initial assessment, patients may be treated at the hospital where they are first admitted, or they may need to travel to another hospital for specialist treatment called a thrombectomy, usually to Cardiff or Bristol, as happens now. How long patients stay in hospital and when they are discharged can vary, and the priority is always to provide the best possible care for every patient. Over the past few years, patient stroke care has changed a lot. Here in Wales, we have seen the introduction of new national stroke standards. Currently in Hywel Dda, we do not meet those standards. We want our patients to have the best care possible and be able to recover from a stroke so that they can lead a full and healthy life. This is why we need to change the way we deliver stroke services across our 4 main hospital sites in Ceredigion, Carmarthenshire and Pembrokeshire.
Stroke was one of the 9 services included within our clinical services plan that we consulted on in 2025. We recognise that some of our hospital services are fragile and that our clinical teams are spread across multiple sites, making it challenging to give the best and safest care to our patients. In February this year, our board made a decision on the future model for 8 of the services included in the clinical services plan. But the future service model for stroke has not yet been decided. We want to hear from you before a final decision is made.
For a period of 8 weeks, we will be listening and talking to patients, carers, families, staff and our wider communities about a new idea for how stroke services could be delivered across our area in the future. Our preferred option. Here's how it could work. There would be a stroke unit at Glangwili with 24-hour specialist cover 7 days a week. Bronglais, Prince Philip and Withybush hospitals would become treat and transfer hospitals. Stroke patients would be transferred to Glangwili from these hospitals for their acute stroke care. Bronglais would also have a stroke rehabilitation unit, meaning patients closest to this hospital would be transferred back to Bronglais from Glangwili for their stroke-specific rehabilitation. In this model, all patients would still go to the nearest hospital, just as they do now. There would be no change to how people first access care and assessment.
Throughout the different consultation phases, we have considered the impacts of the potential changes on how we deliver our stroke services. Bringing the specialist staff together will help us deliver better care for our patients, strengthen the service in providing 24/7 specialist care, and help with staff shortages. More patient transfers will be needed, and we know this will impact on travel and transport for you, your loved ones who may visit you in the hospital, and our staff.
So we want to hear what you think about the preferred option for stroke, what it could mean for you, and what you think we need to consider to make stroke services work better in the future. You can get involved and share your views by the 26th of July 2026. You can do so by joining one of our online or in-person engagement events, completing our questionnaire either online or requesting a printed version. Your feedback will help inform the final decision on how stroke services are delivered across Hywel Dda. To learn more and share your views, visit hdUHB.nhs.wales/stroke-consultation. Thank you for taking the time to help shape the future of stroke services.